it's your girl, MadonnaJ. Joining me on Avenue 981 inside Women of Promise will be Dr. Rachel Corridon, the gentle gynecologist, as we share issues that women face, that young ladies face right here. You got to be in touch with your body. Know as your body's a temple of God, you got to be taking care of it. So ladies, we take care of everyone else. It's time you take care of yourself. So join us from 12:30 to 1 p.m. this Wednesday as we discuss women issues as fibroids. Lots of persons are saying that seem to be the norm. Irregular cycle, heavy bleeding. What are the causes and what can we do to prevent it? Be sure to join us, your girl MadonnaJ and Dr. Rachel Corridon from 12:30 to 1 p.m. this Wednesday right here on Isaac 98.1 FM, The Promise. Tobago and to those locked on via the World Wide Web. It's your girl, MadonnaJ here, and I have the distinct pleasure of having Dr. Rachel Corridon on with us today. And it's all about asking the doctor. And I saw in her name line, she has the gentle gynecologist. So I'm going to first welcome you to Women of Promise on Isaac 98.1 FM and tell us why you would have the name gentle as your attached to your name tag.
Hello, Trinidad and Tobago, the World Wide Web. Yes, I am Dr. Rachel Corridon, your gentle gynecologist. Yes. Why am I the gentle gynecologist? It's really my patients who called me that, in many words and in many ways during examinations, how I speak with them, how I interact with the patients. They always comment that the interaction was so different to being seen or examined or speaking to other doctors. And I said, you know what? That's my trait. I'm gentle. So I'll be your gentle gynecologist.
All right. So therefore, ladies, call up a friend, call up a neighbor, because this is an awesome opportunity in case you would have had fears about going to the gynecologist. So even some not too good experiences, here we have Dr. Rachel with us going to share. So seeing that Women of Promise caters for women globally, and even as I believe in godly seed, many times when persons go for counseling, I'm not sure if this is included where the male person will check their sperm count to make sure everything is okay. The lady will check to make sure all her gynecology, what is going on with her, that way is in place. So can you share with us some of the tests you believe that persons who are planning to get married or single and want to make sure that they're okay, some of the tests they can do that can help them with future reference?
All right. Well, we don't go deep into investigations before even trying to get pregnant, but what we do recommend is preconception or even premarital. What is conception? Conception is the process of getting pregnant. So before you get pregnant, before you get married, we do recommend that you see your doctors, you see your physician before the act, right, so to speak. And, generally, you don't know sometimes everything that each partner may have been exposed to before you're coming together. So we would generally speak with the male, speak with the female, get your general history, your medical history, your social history, surgical history. What is social history? Your practices, sexual partners in the past, your drug history, alcohol use, anything that is at risk or anything that we can advise you to tailor or to cut down on, we would do that then. In terms of the male, we would look for his occupational hazards, where he works, chemicals he may be exposed to, things like that. And in terms of the female, that's where the gynecologist gets a little more in depth. We get into your gynecological history, meaning how are your periods? Have you ever had a pap smear? Have you ever been diagnosed with any issues such as fibroids, cysts? How is your bleeding? Is it heavy or not? Have you ever been diagnosed with polycystic ovarian syndrome? So we have a really long, nice chat. When I say long, I mean about 20 minutes, right? And we get deep into what is happening with your surgeries in the past. If you had any children in the past, how old are the children or how long ago this was, and any complications during that pregnancy, labor, and delivery. And then we would go on to your physical examination. This is for the woman. We would touch on your tummy. We would do a pelvic examination, which if you have never had intercourse before, we call that virgo intacto or a virgin. We may hold on vaginal or pelvic examinations, but if that is not the case for you, we would go ahead, pass a speculum, take a look, do your pap smear if you're not up to date. And also a breast examination could be done as well, not an ultrasound, just a manual breast exam. So we just to make sure that in general, you are okay. In terms of the male, he can see his urologist. They will get his male history and also do a physical exam and they will check the scrotum, they will check the penis, make sure that everything is in order, right? So that when the couple is ready, they can start.
I have a
Right?
question.
Sure.
When you mentioned the other name for virgin, I'd love to get a Virgo somebody.
Virgo intacto.
Virgo intacto. That's a new word I'm learning. Virgo intacto. So all the virgins out there. So my question is, you mentioned that if the person never had intercourse, you won't go deep with regards to a vaginal.
So basically, it is not when you use the word contraindication. Having never had intercourse is not a contraindication to having a pelvic exam, meaning we can examine you. We can do a pap smear, but some women prefer not to, right? And it's not like the pap smear is going to take away your virginity or anything like that. But the whole process may not be something that the woman is comfortable with, and that is okay. Now, if you don't have any particular issue, gynae-wise, we can let that pass, right? Not having heavy bleeding, not having any abnormal discharge, your pelvic ultrasound or your pelvic exam, your abdominal exam, all of that was normal. You don't have any abnormal pain. So you're basically fine. There may be no reason for us to go through with such an exam, but it doesn't mean that you cannot. So we have some women approaching their 40s, 45, and still have not had a pap smear, for instance, because they are still a virgin. You can get your full pelvic examination. We will use the smallest of speculum available to make the process as comfortable as possible.
I have another question. What do you call an abnormal discharge? So for somebody who never had intercourse, what do you consider an abnormal discharge for women out there?
Anything coming out of the vagina that is a difference to your normal, that's the first thing, that's abnormal. So if you're accustomed just having a light film on your underwear, you don't necessarily have to wear panty shields, and suddenly this has changed over the last few days, then take a look at it. Now, you may have normal changes in your vaginal discharge during your cycle. So during your ovulation period, your discharge may become a little more clear, stringy, so it was more stretchy, allowing, because your body is preparing to meet sperm, right? So it becomes a little thinner, etc. And as you approach your period, it thickens back up, it may become a little white, but it's not an abnormal discharge.
Wow, that's amazing how the body responds.
Correct.
So your body prepares, I'm hearing a doctor say it, but I grew up hearing my mother said it as well, that your body prepares, to receive a sperm at that point in time. Wow.
And also when we say abnormal, so abnormal meaning what's not normal to you, abnormal also includes the additional symptoms that may come with the discharge. So we're looking at the quality of the discharge. So what is it like? The color, the smell or odor, right? So the quantity of the discharge also, how much? Normally, you don't have to wear a shield, and now all of a sudden, for the past few days, your underwear is getting totally messed up by discharge. It's cream in color, it's green in color, it's white in color, chalky. So all of these indicate an issue or an abnormality. Also, additional symptoms like itching or burning, that is not supposed to happen. You're not supposed to be aware of your vagina, basically. You're not supposed to know that you wiped, let's say, after using the bathroom. It's not supposed to be painful. It's not supposed to cause bleeding. It's not supposed to cause itching. So anytime you see symptoms like that cropping up, then you have to look into it. Now, sometimes you may use a different bath soap, for instance, and it burns the area because you're sensitive. I'm not speaking about that. I'm speaking about the area generally being on alarm, on fire. Itchy, scratchy, fire, alarm bells, right? That's what we're speaking about in terms of discharge and an abnormal environment going on in the vaginal area.
Wow, that is so enlightening. I'm sure to many women out there, even those who won't be aware and just would take life for granted. So once you realize it's abnormal to your normal, you can, go see Dr. Rachel Corridon and she can help you. So moving along, it's something very close to my heart as well. When persons realize that there are issues, this is before marriage, with regards to fibroids, polycystic ovaries, can you just give us a synopsis on the differences of those?
All right. So we do your history examination, we may find some obvious things, as you said. So in terms of the history, we may find abnormalities in terms of how often you see a period, how heavy a period is. You don't see a period at all, even, right? Or you see a period too frequently. You are using a lot of pads, soaking a lot of pads, or you may tell us that you find that your tummy is always enlarged. People ask you if you're pregnant, right? So in certain circumstances like this, we then jump into our physical examination and additional tests, such as your ultrasound, right? That would be our first step. In the physical examination, we're looking to see if we're feeling anything like a bulky mass in the tummy or in your pelvic area. And these could indicate fibroids, which are non-cancerous. Let's be clear. Fibroids are non-cancerous growths. So we call it like a ball of cells within the muscle of your womb. And these fibroids or ball of muscular tissue, they can be anywhere in the womb. They can be on the outside of the womb. They can be within the muscle of the womb. They can be within your cervix. And they can even be within the lining of the womb. And particularly when they are within the lining of the womb, they cause the heavy bleeding. Or when you have multiple fibroids, you have this heavy bleeding. They can be blocking the junction between your tube and the womb as well. And in those cases, they can cause issues with fertility, but you will not know that until you start investigating.
Right.
Right?
I have a trick question just to interject in between there. With fibroids as well, will your period be painful? Very painful? Does that cause a lot of pain?
Yes, you can have, we call it pelvic pain or pain within that bony girdle, where right below your tummy. You can have pain there. So the fibroids can cause pain. They can cause heavy bleeding. Also, they can cause pressure symptoms. So you always feel full or heavy down in the lower area, pressure symptoms on your bladder. So So you're going to the bathroom frequently and you're always letting out just a little bit. And it's because the fibroids are pressing on the bladder. And so they're always making you feel like your bladder is filled. Yeah. And if your fibroids are large enough, entering and coming up to the top of your tummy, they can make you feel full as well. So you're not able to eat a full meal. Yeah, fibroids can affect you a lot. Yeah.
Wow,
It
wow.
can
This is
also
so
cause
enlightening.
compression of the nerves, so you may get numbness according to where the fibroid is. It could affect your legs, for instance, and that can cause pain and numbness and stuff like that as well.
Wow. And so on just fibroids, just a little more, would there be pain in intercourse as well if someone has fibroids?
Depending on where the fibroids are
Places.
located, that
Right.
could happen as well. Yeah.
All right. Okay. Polycystic ovaries.
Polycystic ovary. So we have polycystic ovaries and we have polycystic ovarian syndrome. So you
Okay.
can have a woman who does an ultrasound and the ultrasonographer or the doctor tells her you have polycystic ovaries, but this woman has absolutely no other symptoms or signs. What are the symptoms or signs? We look at, I don't know if you remember a long time your mommy telling you, scrub behind your neck black. It's
Mhm.
not dirt. It's a sign of insulin resistance, right? So, and that's something we find in women with the syndrome. So
Oh,
insulin resistance, high risk of developing diabetes mellitus in their lifetime. Also high cholesterol in their lifetime. We also look out for signs of high testosterone, or we call it hyperandrogenism. So high male type hormone in the female. And how does that present? We're talking about things like hair. So you have to shave, or you may have male pattern hair growth down by your pelvic area. Women would usually not have a lot of hair on their lower tummy, right? It's usually like a thin line, but you may have a lot of hair down in that pelvic area below your belly button. Hair on your chin, hair, mustache, and like a male pattern hair growth coming down from your temples as well, right? So things like that. And also there are certain blood tests that we can do to look out for it, and of course the ultrasound. And we have to fulfill at least two criteria to diagnose someone with having polycystic ovarian syndrome. So it's not just seeing polycystic ovaries on an ultrasound, right? And how that may present, the woman may have absent or very few periods, so less than 4 periods in a year or no periods at all, right? That's what we are looking for, and that is a sign that she is not ovulating. So how polycystic ovarian syndrome affects your body is that it causes your follicles not to develop. So how you have a cycle is every month you release and one follicle decides, hey, I want to be a baby. So it develops, gets bigger, gets bigger, and buds off of your ovary at ovulation time. And that's mid-cycle. So that's around like day 14. That's your mid-cycle. Some women may feel ovulation pain, some may get those changes in their cervical mucus and stuff like that. And if that egg is not fertilized, it will just disintegrate and you will see your period within another 14 days. In a woman with polycystic ovarian syndrome, that is not happening properly. And so eventually she may have issues with her period. She may have issues with conceiving when she starts trying. And we may have to help her ovulate at that point.
wow. Wow, that's a lot. And
Yes, it's all right.
you hear a lot of people talk about it as well, especially with the excessive bleeding for a long period of time. So which one of them carries that? Because I've had friends who would have said, polycystic ovaries or I don't know, or is it the syndrome?
ovarian syndrome can also, so you have periods where you're not bleeding, and then you're going to bleed, and you're going to bleed excessively heavy. And the reason for that is you have unopposed estrogen hormone causing overgrowth of the lining. So you're not having a regular monthly shedding of your lining, and that lining just overgrows and overgrows, and then it breaks and bleeds, right? Because it's not a stable growth. A stable growth happens only when you are having a normal, regular cycle, right? And so when this overgrowth has happened and the lining cannot contain it anymore, you will bleed, and you will bleed excessively. You can bleed irregularly. So you're bleeding, you can bleed today and bleed 2 weeks after again. So it's not a controlled and regular cycle. And so these women as well can have heavy bleeding.
Wow.
Prolonged bleeding, yeah, as well.
Wow. Wow. I heard so many stories with that. So moving
It
forward,
affects a lot of women.
yeah, but my question is regarding that kind of detection and people realize that they are bleeding excessively like that. They are required to see a physician. Some persons take it as though it's just heavy bleeding and they accept it
Yeah.
and move on in life for years.
I see patients at times who they only present or come in when things are really bad. So their blood count is so low that they have either fainted or had a near fainting episode. They're dizzy, they're weak. Their family may have told them, girl, you're white like a sheet. So they're pale because they have bled down their blood count so much that now they need urgent attention and blood transfusion. I've had patients come into me in the clinic and they're not aware that things like doubling up maternity pads, using baby pampers, or using Depends for your period is not normal. That kind of bleeding is not normal.
I hope persons are hearing this, it's not normal.
That is not normal. You need to come in for us to see what is happening. Things like messing up your sheets. You shouldn't. We call that flooding. If you put on a regular nighttime pad, you should be able to sleep without your sheets and your clothing totally being soiled or having to jump up and go to the bathroom to check. Correct. That is not normal.
Accepted as normal in Trinidad and Tobago. Because I know some young persons, now that I have a teenage daughter, would be telling her they would have that overnight and they have pattern in their headspace. So we need to talk to young people about this as well, because they have it in their headspace that, okay, I need to buy 2 packs because in the night I would be so heavy, I must change. And therefore that has become the norm, right?
Yeah.
And so I don't know if because of generations, we have just accepted that that is okay when it isn't. So now we need to really educate persons, women and women of promise, and the young people as well, young ladies as well, of the importance of monitoring your cycle, because I don't think that is schooled as well. So you're even educating me. So I'm going to tell my daughter, start monitoring your cycle. Let's make sure that this is normal, a normal procedure that has to happen, process in life until,
And there are easy ways to monitor your cycle, Madonna. You can use a calendar. That's the old school way. So my mom would tell me that my father and herself, they would.
Yeah, Monica. Back in the day.
He was the marker of the calendar. He knew when it was free and he knew when they needed to use extra protection. Because in those days, they were using barrier method.
Yeah.
But you can use that the regular. If you like to write, you can use a book, a notepad, a diary, a calendar. But if you're a little more techie, there are lots of apps where you just have to click and it does your recording for you. And after a few months of recording, it's going to give you some insight as to the length of your cycle, how many days you bleed, and then you are able to decide or to determine if you have an issue just by using the app.
And
You
and
can
with
even feel
regards
your
to
symptom.
and with regards to the heaviness, I really want to emphasize with that, where you mentioned once you realize that you're changing too many overnight pads, something is wrong. So we need to let you know that because I mean, I would have had spillage on my bed, and you're just thinking, okay, the second day heavy. You mentally, make up your mind, okay, this is what is happening. And so could that be okay as well, where you would have days that heavier than others. So mentally, okay, every month, the second day, heavy and that kind of thing. Should you still get it
That, I
checked out?
mean, yet some women do have that. So they
Mhm.
know when their period is going to be heavy, but there's heavy and there's
Okay.
right. So we want you to, if you, as you're listening to this today, take a second look,
Mm-hmm.
right? So go back to it again and determine if you really think this is something that is normal or you should come in to get checked. Let's talk about it.
Wow. Wow. We must have Doc back, right? So in case you're just joining us, I'm here with Dr. Rachel Corridon. She's also a first lady, but we leave that for another day. And she's your gentle gynecologist, all right? And enlightening us as ladies and for us parents as well who would have teenage daughters on how and observing because our time has been totally different. We have evolved. Thank God
Yeah.
for persons, becoming more and more educated and would want our children to be aware and be in tune with our bodies as well as women in not taking things for granted, And so therefore, moving forward after, the different cycles, the heaviness, what else can we look for with regards to our menstrual cycle? Because at the end of the day, in another program, we're going to talk about trying to conceive after you get married and different things like that. But as an individual, as a young person, as an adult, as somebody who's single, who would want to get married, you need to take care of yourself, right? So Dr. Rachel is advising us and encouraging us to do that. Yeah?
Yes.
So what are some other signs that we can check on? Because you mentioned as well the bloating. And then
So
person,
the increasing tummy size.
yeah.
The doctor may use the word abdominal girth. It just means the size of your tummy, right? So you are young, you're slim, and you have a tummy. Why is that? So it could be fibroids, but it could also be enlarged ovarian cysts, right? They can be so large that they can make your tummy become visible, right? So we would have to examine and do an ultrasound to see exactly what is happening there. Sometimes, I mean, yes, it could just be a little bit of tummy fat. But if you are actually feeling something inside your tummy, some women even say, I'm feeling something moving, right? And they're not pregnant. So they've done a pregnancy test. They're not pregnant. We have to check out and see what is occupying space inside your tummy that's not supposed to be there,
That is so
right?
true.
And
And
we can also look at things like the length of your period. As I said before, you should not be bleeding. A normal, typical period lasts 5 to 7 days. You definitely should not be bleeding more than 10 days. So those ladies who bleed in 14 and 21 days and life going on life like normal, that is not normal. So we want to check on that. Yes. And spotting in between as well. When you see a period, when that 7 days, seventh day has come and your bleeding stops, you should not see any bleeding at all until your next day one of your period, be that 28 days, 30 days or thereabouts, that's the average. You should not see your period or any bleeding before that. So generally, you should be seeing your period no more than every 21 days. And so you shouldn't be seeing it more frequently than every 21 days. Yeah. And no further than 35 to 40 days.
wow. So if after the seventh day like you people will say draining out, and it's coming like a bit dirty, so that probably might go for a 3 days, a 10, until you just don't see it. Is that acceptable or something you should check as well?
Up to 10 days is acceptable.
Okay.
After that, we need to have a chat. Come, let's have a chat.
Right. Wow. Wow. So you see a lot of things that you got away with in the past that you thought was normal. It's not normal, okay? And something you said, which was very crucial about persons bleeding and then their blood count now dropping. Again, they're not understanding that the amount of bleeding is making their blood count low as well. And because they're losing blood, and you would hear the old story of taking iron tablets and that kind of thing, and then sometimes you take it to bleed more. You know, what's your take on those myths, as it were?
Taking the iron tablet is only to boost your blood count. So basically, it's giving your red blood cells, the building blocks to make hemoglobin, which is the oxygen carrying part of your blood, right? And so when you are bleeding, you're losing iron, and so your body is not able to build back this hemoglobin as quickly, and so your blood count drops, right? So if you are having an issue with bleeding, yes, by all means, take your iron. The iron does not make you bleed. It can, however, cause you to have constipation. And so some women really prefer not to take it, but there are different ways to take iron.
Yeah.
You can take iron in your foods. If you are taking your iron in your green and leafy vegetables, certain types of peas, things like beetroot, right? You are going to boost your body's ability to bounce back in terms of your blood count. You can take liquid forms of iron orally, that's by mouth. And sometimes if we really need to, we can bring you into the facility, your doctor's office, your hospital, and give you iron in your vein, right? And beyond that, sometimes you just need blood. If your blood count is below 7, that's a general cutoff. It's not an absolute, but it's a general cutoff. If your blood count is below 7, if you're having symptoms, so the symptoms would be dizziness, weakness, shortness of breath, or you're feeling your heart beating and bounding and beating quickly, so palpitations in your chest, then those are signs that your blood count is low. Then we need to pull a blood panel, we call it the complete blood count, and we look at your HB, your HB level or your hemoglobin level, and then we determine what we need to do next.
All right. My mom said all those little things. She was not a doctor, but she was in the hospital. So tell her that she was a doctor, right? But it's so much more to get on women today. On Women of Promise that we really want to enlighten you on. So be sure, once Doc is available, we'll have her. I'll try to have another session next week, God's willing, as we follow up on, women's health. Right, and women's reproduction, and that type of thing. It's just about that time for us to say our bye-byes, and thank you so much, Dr. Rachel Corridon, for coming and share. If you can give us your handles so persons can follow you as well, and a contact number where they can come visit you. I'm finding out here some more information, even for myself. Visit Dr. Rachel.
No problem. So it's quite easy. My handles on Instagram, TikTok, and Facebook are Your Gentle Gynecologist. It's quite easy. And my business handle is Harmony Health TT. Right? So they both work together. Yes. You'll see both of them popping up all the time. So Harmony Health TT and Your Gentle Gynecologist on Instagram, Facebook, and TikTok. If you want to WhatsApp me, you can do so at 494-MONI. So that's the business line. Harmony, MONI, MONY, 494-MONI, or 494-6669. Right? You can also email at drcorridon at harmonyhealtht.com. And those are the
Awesome.
ways you can
And I know that you'll one
get
more.
the website,
Pardon?
the website,
Go ahead.
www.yourgentlegynecologist.com.
Awesome. Yourgentlegynecologist.com. Be sure to look her up, and then you can call me at 376-0080 for more information. So I just get you on to the doc, 376-0080. MadonnaJ signing out on Women of Promise. Love you guys a whole lot. Look forward to us living healthier and taking care of ourselves first. You know, when you go on that plane, they tell you make sure you take care of you first. Then we deal with the children and everybody else. So we know that you love everyone and you love taking care of everyone, but it starts with you. All right. So I'm signing out. Thank you, Doc. Look forward to being with you again. Have a wonderful day. Yeah. So Trinidad,
Bye.
so we are Hey ladies, it's your girl MadonnaJ. Joining me on Avenue 981 inside Women of Promise will be Dr. Rachel Corridon, the gentle gynecologist, as we share issues that women face, that young ladies face right here. You got to be in touch with your body. Know as your body's a temple of God, you got to be taking care of it. So ladies, you know we take care of everyone else. It's time you take care of yourself. So join us from 12:30 to 1 p.m. this Wednesday as we discuss women issues as fibroids. Lots of persons are saying that seem to be the norm. Irregular cycle, heavy bleeding. What are the causes and what can we do to prevent it? Be sure to join us, your girl MadonnaJ and Dr. Rachel Corridon from 12:30 to 1 p.m. this Wednesday right here on Isaac 98.1 FM, The Promise.
Isaac 98.1 FM. Inspiring families. Inspiring